Hi, let's talk about volume loss in the face. It's all over social media, oh, our faces are losing volume as we get older and you just need volume replacement with dermal filler. It's not as simple as that. There is definitely a little bit of volume loss, particularly the deep fat in the cheeks. But the superficial fat tends to slide down, and in some areas it gets even heavier. So nobody ever comes into me and does this and says, make my face like this with more volume. They generally are interested in lift, and they'll come in and it'll either be one finger, I need a bit of this, or two fingers, or if they really feel they're in trouble, they'll do the whole 3 fingers. And that gives me an indication that the issue is not so much volume loss, but it's really laxity and it's degradation or age and wear and tear signs in the skin. Yes, there's some fat changes, but actually a lot of that are things sliding down and the bony skeleton underneath is shrinking a little bit. We know our hips and spine are thinning and getting a bit smaller as we get older, and women in particular tend to lose a little bit of height over time. So on the face, similar things are happening. The mandible here is shrinking, the maxilla, the mid-face bone here is shrinking back and rotating, and the eye sockets are getting bigger. So all of these changes are happening on every level. So yes, you can add a little bit of volume, but you really want to do that very subtly. And if you add too much, you'll get what we call pillow face. And we've all seen celebrities who've had that and it's too much. Also, over time, that filler can draw in a little bit of water after it's first injected, but equally over time, as it breaks down, it can draw in water as well. And we know that some hyaluronic acid fillers can last up to a decade. Traditionally, we'd say to patients, 6 months, 9 months, 12 months, and some of the newer products, maybe 18 months or 2 years. But actually, in studies done, you can see some ultrasound changes or some MRI changes years later if it's hyaluronic acid. So I think volume loss, yes, but go very subtly. Don't overfill a face. Look at somebody's whole face and their proportions. Look at their neck and their body. So don't overfill somebody who's very slim. We call that lollipop head. So too full a face, slim neck and slim torso. It doesn't match. So it needs to be done very cautiously and carefully. I think with volume replacement, we talk about how much do fillers lift. Now, I think of it a bit more like camouflage or disguising signs of aging. One of the common signs of aging is really sagging. So if I can place products in certain areas, I will replace a little volume. I'm not going to get significant lift. Fillers just don't have the properties to do that, although we'd love if they did. What I'm really doing is disguising and making changes so that I'm camouflaging the signs of aging. So yes, there's a bit of volume replacement. Yes, there's a really tiny amount of lift, but more of it is just regenerating or getting somebody back to where they were before and not overfilling them and not giving them a face that doesn't match the rest of their body. If you're seeking treatment, there's loads of other options besides injectables. I love injectables, don't get me wrong, and they form a daily part of my practice in the clinic, but we're also looking at skin quality, at trying to improve skin laxity, and not just filling like blowing up a balloon. So I hope that's helpful. Do get in touch if you have any questions. Take care, bye.